We are Essex Health and Justice Service. We cover all of Essex, and we've got a worker in Colchester, Tendring, Harlow, Chelmsford, Basildon, Southend and Grays. We are responsible for assessing adults for drug and alcohol treatment orders at court, and we also offer some support to voluntary attendances, which are people either at pre-charge stage or for whatever reason are being dealt with outside of police custody. If we identify any adults with any additional support needs, then we refer them on to our colleagues at Full Circle. Our primary role is supporting young people involved in the criminal justice system, regardless of what level that involvement might be. And we offer them practical support in the community to handhold them into the services that they need. Sometimes we come into first contact with our clients while they're still in police custody or at court. We also receive referrals from other agencies such as social workers, healthcare professionals, police officers and custody staff, the Essex Probation Service, and the Youth Offending Team. Essex Health and Justice Service is a partnership of agencies, along with CRG, which are a private medical firm, and an NHS mental health service, to provide an integrated service that meets people's needs while they're in these environments. The main part of our role takes place in the community, where we support our young people to make positive changes by accessing the right support at the right time. By supporting young people at these really crucial teachable moments, we're helping them to achieve improved outcomes and reducing reoffending rates. We're also bridging a gap in existing provision for those young people that might otherwise fall under the remit of or not come into contact with other services. And crucially, we're ensuring that young people with complex and additional needs are not alone through what can be a really uncertain and scary journey. Since we started in 2018, some of the things our young people say they value most about our service are that we make them feel listened to, we take the time to get to know them, we don't judge them, we help them to set their own goals, we believe in them, and we make them feel like things can get better.
Hi, I'm Ben, and these days things are going pretty good, but it hasn't always been that way. I had a pretty difficult start in life because my mum and dad have drug and alcohol problems. As I grew up, I didn't know how to deal with it, and I started to get really angry. Sometimes I would lash out and it would get me into trouble with the police, and I got arrested quite a lot. I soon found that smoking weed helped me to calm down, but before I knew it, I was smoking it every day. This worked alright for a while, and when I was 14 I got a girlfriend I really liked. It was an accident, but she got pregnant, and when we were 15 we had a baby together. The first time I held him, I knew I'd do anything for my son. I stopped going to school and got some cash in hand work so I could step up and be a good dad. It was great until we broke up and I didn't get to see my little boy anymore. They moved away and I didn't know where they were or what was going on. I felt like I lost everything. I had no qualifications, no job prospects and no contact with my baby boy. Then I started getting angry again. I kept smoking weed to make me feel better, but before I knew it, I started feeling too anxious to even leave the house. I would just spend all day in my room smoking weed and not talking to anyone. It wasn't helping anymore because I was still getting angry. This time when I got arrested, my worker from Health and Justice came to talk to me and asked if I wanted to have a chat. This really helped me to calm down, and I felt like someone was actually on my side and wanting to listen to me. My worker pushed me to get out of the house, even if it was just for us to meet at McDonald's. She helped me to see that things could get better and came with me to speak to my doctor about how I was feeling. My doctor referred me to the mental health team, and my worker came with me to my first appointment. My worker gave me some tips on how I could start cutting down on the weed. I really liked that she never judged me for smoking weed or told me what to do. I started to feel there was hope, so I stopped smoking it altogether. My worker helped me to believe in myself and helped me get into college. She came with me on my first day to meet with all my teachers to make sure I felt alright. I realised there were other ways to deal with things without getting angry, and I stopped getting myself into trouble. My worker got in touch with social services to try and find out what was going on with my son and helped to make sure they knew I was doing everything I could to be a good dad. Things were going really well until I got some bad news and everything fell apart. I found out me and my family had to move to a new area. I was feeling really down, I started smoking weed again and I was losing hope. But as soon as I let my worker know, she came and met me and she made sure that all the support I had and my education was transferred over to my new area. She came and met me after I moved to make sure everything was going okay. Since I've moved, I've done a course and started having contact with my son again. Now I'm feeling really positive about my future and I'm hoping to become a young person's worker to help other troubled kids like me.